So today's topic of discussion is pediatric history taking. It is very useful for MRCPCH clinical examination, DCH and MBBS examination. First, start with the history of present illness. You have to start with the onset, progress, duration of the current illness, and associated aggravating factor and relieving factor. Suppose a patient presented with childhood asthma. You have to take the history of the factors aggravating the situation, particularly the triggers, and the relieving factors like any medication that relieves the symptoms. And now we have to take the relevant history of the association, like any eczema, hay fever in case of asthma, and any complications. Suppose a patient is having fits and any complication happen afterwards, like aspiration pneumonia. And then you have to take the important negative history. Important negative history you have to take relevant to the topic of discussion. Suppose a patient presented with headache, so you have to take a relevant history of CNS symptoms. Suppose a patient presented with constipation, then you have to take the relevant history of GI system, and you have to take history of how is wee and poo. In past medical history, you have to take the history of similar episodes in past, any past surgical history, any past hospital admission, and what are the tests done so far, and the treatment that patient received so far. And you have to take the compliance history and side effect of any medication, and any consultant follow up done afterwards, and uh, who are the consultants associated with this patient care. And then the birth history. Birth history are divided in three parts. Antenatal history, there you need to ask about the drugs and any infection happened during antenatal period. And after birth, whether the baby is term or preterm, what is the mode of delivery, any history of birth asphyxia, hypoglycemia, or any intraventricular hemorrhage, or any hypoxic ischemic encephalopathy happened. In postnatal history, you have to take the history of any neonatal jaundice, HIE, IVH, meningitis, and sepsis. Immunization history is very much important, particularly those patients presented with chronic lung disease, asthma, cystic fibrosis, immunosuppression patients, as well as the cardiac patients. Nutritional history is important for diabetic malabsorption syndrome patient, celiac disease, inflammatory bowel disease, and the cerebral palsy patient, those who are dependent on NG2 fat, peg fat, and the scenario where high calorie diet is required. Development history is very vast section. You have to take the gross motor, fine motor, and speech and social. You have to take relevant history of those section. But those who are taking the development station, then you have to ask few additional question like vision and hearing, change of head size, skin marker fits, loss of acquired skill, what is the language at home, and any sign language. And you have to ask whether the child behave differently from other children, and whether the child is look differently from other children, and any diagnosis made so far. Additionally, you have to take the pubertal history and history of allergy, important for asthma, eczema, hay fever, celiac disease, and cow's milk protein intolerance. In family history, similar illnesses are to be inquired in the family, or any other major illness, a consanguineous marriage, and if this child is having any respiratory symptom, you have to ask about the flooring, any pet at home, or any indoor or outdoor smoking, and you have to draw the pedigree. In social history is very much important because most of the time the hidden agenda lies here. So meticulous history and immense importance given so far to the social history. If you are running out of time, don't forget to take the social history at least. Ask about the school, how is the academics going on, is there any history of bully or any laws of school days, what is the situation at home, any education healthcare plan or any social support the child is getting, and how this current symptoms or disability affecting the child, and how this affects the family. And you have to take history of any foreign travel as well. Thanks.